Doctor, my friend who is 7 months pregnant has been leaking a clear watery fluid for 3 days now. What should we do? So this condition, we call it a premature rupture of membranes, and it is a very serious condition. It warrants urgent medical attention. Now, during pregnancy, inside the uterus, the baby will be surrounded by this fluid we call the amniotic fluid. It acts as a shock absorber and it protects the baby. Now, this fluid will be sealed within two bags or membranes. We call the amnion and the chorion. They will also prevent any bacteria from entering and causing infections. During labor and the entire birth process, these membranes will either rupture naturally from the pressure of the contractions, or they will be ruptured artificially by a midwife. This will help to quicken the labor and to allow the baby to come out. But now, in some cases, even before labor has started, you might find them leaking and this water coming out, and this is what we call premature rupture of membranes. There will be variants to this condition depending on the age of the baby. So if it occurs before the baby is 37 weeks, we call this one pre-labor, preterm rupture of membranes, and usually they will be more serious than one that occurs when the baby is already 37 weeks. Anything that causes weakening of these membranes can lead to rupture. So number one cause will be inflammation from infections like urinary tract infection. Then you can have sterile inflammation from tobacco smoking. Then you have those ladies that have a short cervix, what you call cervical incompetence. They tend to also have a lot of abortions or miscarriages around the second trimester, around 13-14 weeks. Then things which cause extreme uterine distension. So for example, a very large baby or having multiple pregnancies like a twin pregnancy. Then people who have connective tissue disorders like problems with their collagen, a condition we call Ehlers-Danlos loss, and all those people who have nutritional deficiencies, when you have low ascorbic acid, vitamin C, or copper, these ones are used in the manufacture of collagen. So if you're not having enough, the collagen will be a bit weak. Then things causing vaginal bleeding in the second or third trimester, what we call APH or antepartum hemorrhage. So for example, placenta previa, placenta abruption. And lastly, a mother who is very small and short, what we call a short stature. When you come to hospital, the doctors will do a pH test to ensure that this is actually amniotic fluid. Usually, the pH of amniotic fluid is more alkaline than the pH of the vaginal secretions, which are more acidic. Treatment will usually depend on the age of the baby and whether there has been any bacteria found within the amniotic fluid following a culture and sensitivity. So if the baby is 37 weeks and above, we shall just prepare and we do active delivery. Then, if the baby is between 34 to 37 weeks, here we shall first of all give IV dexamethasone to help the baby's lungs to mature. Then we shall give antibiotics to prevent any infections, and we shall give a tocolytic for around 48 hours. A tocolytic is a drug that cuts off contractions. We give it for 48 hours to allow us to give the dexamethasone dose in full, and after that we can either deliver the baby actively or we just